fresher, feels much better about herself too. The skin looks just wonderful, and I see her from time to time now in the future, and the condition has just improved by at least 90%. Liposculpture is the new method to mold the body into a more appealing form. Areas that can be treated include the ankles, the calves, medial and lateral knee area, medial thigh, the saddlebag area in women, the abdomen, love handles in men. In addition, the arms can be done with sculpture, as well as the neck area and even the posterior neck, where we see a buffalo hump deformity in some patients. Almost every part of the body can be molded in this way. In fact, we are doing mega liposculpture to help some people reduce their severe obesity. But that is the subject of another tape. People also ask, what does one do with the tape, with this extra fat? What we can do today is take this fat, wash it, treat it, remold it, and reuse it back in the body into areas, for example, in the face, as we mentioned, the nasolabial, or to build up the cheek area, earlobes, to make the hands more improved. These are some of the wonderful ways we can basically recycle the fat from one part of the body to another. The tumescent anesthesia technique is also a major breakthrough. We use large dilutions of sterile water, xylocaine, and other solutions to literally blow out the area that we're treating. It causes literally no pain, there is no bleeding, and we can sculpt the entire body by using the tumescent technique. I also use this technique for dermabrasion, but it is mainly a particularly wonderful treatment with liposculpture. Tumescent technique allows us to do treatments under local anesthesia with no pain, no bleeding, and total safety. Other breakthroughs include the fact that doctors now can have a table in their operating room, as I do, where a patient can be checked every few moments by raising the table up, and I can do liposculpture with the patient standing while they are in a harness position, so I can make sure that the liposculpture technique is progressing exactly the way I want to. Because when a patient lies down, gravity does not allow us to see exactly the kind of result we're getting. Computer imaging is another help for our patient, because I can give the patient an idea of how they will look after the treatment is completed through the computer imaging methodology. Some of you may wonder why I call the procedure liposuction liposculpture, because it is just that. Liposculpture is the active, dynamic process of molding and resculpting the body into a more pleasant, pleasurable form. Liposuction, in my opinion, is merely a passive sucking technique, very often done with a machine. I do not use a machine. I do all my work by hand, by syringe, which was invented by Dr. Pierre Fournier of Paris, and I've worked with him on this technique. And as you see, I do it all by syringe, which gives me the same amount of atmospheric pressure for suction as a machine does, but with very little trauma. I never get the irregularities and ridging as seen with a machine. This is a much more gentle, more physiologically correct method of doing this wonderful new process that I've termed liposculpture. As you can also see, the cannulas that I use are very thin, and as a result, they disrupt the body's architecture minimally. And we do not see the collapse, ridging, and irregularities reported after surgery by some physicians. This French technique, originally developed in Paris, allows me, under direct observation, to make a small opening site with a sterile ice pick behind the knee area. And coming in, and under very careful guidance, I am literally molding out these sites very slowly and carefully without the interruption of a very high-powered machine, and enabling me to do a sculpting procedure as a sculptor would do a statue. Now also, if I were doing the neck area, this is a different way to liposculpt. I would be coming in at this area right here, below the ear, on both sides, and I would be sculpting the neck area without an incision. Remember, this is being done without an incision behind the ear. And literally after 4 or 5 days, this patient is perfectly healed. She'd wear a special dressing for 4 or 5 days, just like she would if I were doing the knees or the abdomen. Of course, for the knees or abdomen, they wear a special girdle. But all we would have to have here is a special dressing to remold this neck, and I could probably improve a neck in the average patient anywhere from 60 to 90% with a 45-minute procedure. It's safe, it's cost-effective, and it's painless. Now let's look at some before and after photos of some patients. This 32-year-old female was very active athletically, but she could never lose the extra fat in the areas of the saddlebag, or which is known as the corvette de cheval. We performed the French liposculpture technique by hand, and we sculpted the area around the knees and the hip area. The post-operative photographs reveal a much more contoured, sculpted patient who is extremely happy. This 27-year-old female exercised and dieted over a period of 3.5 years, but she could never remove the areas around the hips, thighs, and buttocks. Under local anesthesia, we performed body liposculpture using the French technique, syringe method only, no machine, and the results have been superb. This 35-year-old executive exhibited one of the most troubling areas in cosmetic surgery. The area around the chin is almost impossible to remove through dieting alone. Using liposculpture surgery, we performed a procedure to refine the area around the chin and around the jawbone. As you can see, the results were very, very pleasing, and the patient is ecstatic about the results. Another procedure patients often ask about is the rhinoplasty, or nose job procedure. In this case, is a 47-year-old woman who had a rhinoplasty done in addition to having liposculpture of the neck with a small chin implant. In this particular case, the chin implant was achieved through the use of autologous fat transplantation rather than using a foreign body. One of the most frequent procedures I'm asked to perform on patients is lip augmentation. As one ages, it seems that lip tissue seems to diminish in quantity and quality. Many young women also request this type of enhancement, as well as men. We are going to approach this patient and augment both upper and lower lips. As you can see, this is a very beautiful woman. However, she has a little weakness of the upper lip compared to the lower lip. We're going to harvest fat from her right hip area under the special new tumescent anesthesia procedure, and there is no bleeding and there is no pain. We wash and concentrate the fat, remove debris. There is no incision, but merely a needle mark, and this procedure normally would result in a 50% permanent improvement each time it's done. Now, this fat has already been harvested from her right hip. It's been concentrated, cleaned, debris has been removed, and now, as you see, it's clear, creamy white, very clean, and 100% pure fat cells. And basically, this will be a graft. And being that it's the patient's own tissues, it can't be rejected. There can be no allergenicity. It's totally safe, and in the proper hands, this is a very lovely cosmetic procedure. Now, as you see, the cannula is very thin, it's very blunt, it causes very little trauma to the tissues, and as you see here with a small opening mark next to the lip, I will be able to thread this material into her lip, both upper and lower, with almost no pain. The whole procedure to inject in the upper lip and lower lip will take no more than 3 minutes. A small needle mark will allow me to open the skin, and I will go into the lip area, into the vermilion area of the lip, as well as the body of the lip, and fill up this area with fat tissue. And by so doing, from one opening right here, I can do the upper lip as well as the lower lip. There is almost no pain because there's also been anesthesia injected into her lips on both sides, and there'll be almost no bleeding. Open your mouth, please. After I've completed that, I go to the other side and do the same procedure there. We're just molding the area into place. This should be a wonderful take. There's literally no side effect, minimal swelling, and in about a day, day and a half, there's actually no problem. And over a period of a week, the overcorrection will subside. Now, as you've just seen, this patient's had autologous fat transplantation, and this is 10 days later, where we've taken the fat from the hip, we've treated it in a special manner, and re-inject it back into the lips to give it a more attractive, fuller appearance. The healing period exists of perhaps 7 to 10 days, and there is no sequelae or basic discomfort. Live fat cell transfer therapy is perhaps one of the greatest cosmetic developments in the last 50 years. We can literally improve areas in the nasolabial, of course the lips, the cheek area, the glabella, what we call the marionette line, and improve and augment these areas which aging takes away. This has far much greater effect than merely a facelift for the patient who needs it, because a facelift cuts you here and we pull tissue. In this procedure, we are giving back to the body exactly what it lost, the fat tissue. Aging today comprises a loss of fat, not merely a loss of tone. Together, perhaps a facelift or a autologous fat transplantation is the most significant breakthrough, but many times the fat injection merely by itself is all that most patients will need. The blepharoplasty procedure, or what's commonly known as the eye lift operation, is frequently requested. In this instance, upper and lower eyelid surgeries were performed, giving a more bright, open appearance around the eyes. In this case, a chemical peeling was also performed for the hyperpigmentation surrounding the periorbital or eyelid tissues. A major breakthrough in rejuvenation is what we call our complexion peel or our light chemical peels. Now, these involve a combination of glycolic acid and our special mixture of trichloroacetic acid. When combined over a period of time, this can literally rejuvenate, refresh, refine the skin. It's used, for instance, in acne. We use it also, as I mentioned, for skin and facial rejuvenation. We use it for hyperpigmentation, that is for darkening, which is what you have around your eyes. And it's also very effective for patients who've had too much sun damage, that is actinic or solar damage. This type of treatment we usually do once a week for 6 weeks, and thereafter you're seen every month ad infinitum, depending upon what your needs are. But we have patients who come literally every month like clockwork after the initial 6 light peels are done. And the nice thing is that these treatments are not expensive, and they may indeed be reimbursable by insurance, as they are done for a medical problem that manifests itself on the skin. So we're going to begin now. First, we clean the face with some alcohol and some acetone. My nursing assistant will give me that special cleansing aid now. And we begin by cleansing the face gently, but certainly thoroughly, to get off all the sebaceous material and the skin oils. That's the alcohol. Now she'll give me an acetone-soaked gauze pad. Thank you. Acetone is very drying. The patient may experience just a minimal tingling. Being careful around the eye area, not to traumatize the tissues. I also do the earlobes, because the earlobes certainly constitute a part of the face, and a lot of women complain that their earlobes look tired. We also, as a sidecar, we also do injections sometimes into the earlobes with fat to make them look fuller and more attractive. Now I'm going to begin with my light application of my special glycolic, which is a time-based formulation, and my nursing assistant will begin the clock when I start to apply the glycolic. And she will begin with the clock now. Time is nearly up, because we have completed the initial phase of the first peel. Now we neutralize this particular first peel in preparation for the addition of the second trichlor peel. Over a period of time, her complexion will improve markedly. Of course, she'll be using things at home, part of her home regimen of products that we've dispensed to her. She will avoid the sun, that is undue exposure, and she will use a sunscreen. Most importantly, she will avoid all sun exposure between the hours of 10 and 2. We will begin the second peeling now. Now we are beginning our second peel, which is a trichlor peel, which is not as much dependent upon time as the first peel of the glycolic. We begin in the superior forehead first and work our way down. Even in our light peels, we try to do cosmetic units one at a time. This area, for example, the forehead, we determine to be a cosmetic unit. I try in general to peel a full face, but sometimes we do it in cosmetic units. Now we go to the second cosmetic unit, which is the eyelids, the mid-face, the dorsum of the nose, and across the malar prominences, which are known as the cheekbones. Now we go lower to the upper lip, around the mouth, touching the angles of the jaw, and ending with the earlobes. There's minimal discomfort here. A little tingling is all the patient should experience. Then we'll neutralize again with water, but actually this particular peel is self-limiting. Now we're applying a very mild steroid cream to decrease some of the tingling and dryness, and the patient will be applying this twice a day for the next 2 or 3 days, followed by our moisturizer. But this is a very, very painless procedure, and the results over a period of time are outstanding. Patients tell us that they love doing these things because it keeps their skin looking at its optimal level with a minimal amount of discomfort and literally no downtime. They can go back to work the next day. And we make sure to keep the prices at a level that everyone can afford, as I'm sure most doctors doing this kind of work also do. And that's our complexion peel. To further comment on combination procedures, here is a 67-year-old lady who had autologous fat transplantation to the face, a chemical peel, as well as a mini facelift. As you can see, this is a very satisfied patient who is very attractive after this procedure. I would like to discuss a problem now that has perplexed both men and women for centuries, and that is varicose or spider veins, which primarily involve the lower extremities. They can, of course, involve the face, but the main problem that we find in cosmetic medicine today is the varicosities, which are seen in the lower extremities. The main causes of these are perhaps standing, heredity, pregnancy, oral contraceptives, or a combination of all of those factors. The etiology, again, is not that well understood in the fact that we know that there's a weakening of the vessel wall. But there's a wonderful treatment for it called sclerotherapy. And what sclerotherapy does is basically cause the vessel walls of those superficial blood vessels to collapse so they're not visible to the naked eye. We can do that because the deeper blood vessels in the body bring blood back to the heart. So the superficial ones are primarily cosmetic in nature. What we're looking at now is a classic example of a patient who has varicose veins of the lower extremities before treatment. As you see, it is tortuous, raised, sometimes painful, and especially so when the patient stands, and it's classically very dark and hyperpigmented. As you see, there are some vessels around it which are reddish in nature, and those are tributaries of the large vessel. Now here's a patient who has rather classic findings. She tells me that she has pain on standing. They're getting a little more visible. And as we see here, there's a large blue blood vessel here, which is a vein. We shall inject that now. And around it, you'll see some pinkish, what we call telangiectatic vessels, which also can be treated both individually or sometimes they communicate with a larger blood vessel. We shall begin this treatment now. Now, this is the ethoxysclerol, which is a clear solution. It's in a sterile syringe, and we use a 30 gauge needle, which is very, very fine, so the patient will experience almost no discomfort with the injection of this. Now we first clean the area with an alcohol solution in a rotary motion, and we have the ethoxysclerol in a sterile syringe with a very fine 30 gauge needle, so the patient will experience almost no pain or discomfort. It's a small little prick actually that you'll hardly feel. Now we are going to begin the injection itself. I hold the skin taut and I try to enter the middle of the vessel in such a manner. There's a blanching immediately as this solution is pushed through the blood vessel. And we start to inject a minute amount of material. Out we come, and we put direct pressure on the area. And we wait for the next area to be treated. The patient will tell you there's almost no pain at all. Now we're in a different area now for this little red we call streamer, and we're going to inject this ever so superficially right in the vessel, and it's gone. Pressure, please. Good. That's a perfect result right there. And over a period of time, these will heal beautifully without any hint of any treatment. Other vessels may appear at a later date, but that for the most part is rare, and they also can be treated in the same way. Let's do another area right now on the other leg. Now we're in the patient's other leg, and as you can see, she has a large varicose vein right here. And we're going to inject that also, and there's some large communicators right next to it. So we're in the vessel, we inject a small amount of solution, and as you see, there's a blanching almost immediately. This will be an excellent result. Putting some pressure on it, and then the patient will wear special support stockings for 3 days, which we give to the patient. In addition, we give the patient an increased dose of oral vitamin C, which seems to enhance and strengthen the blood vessels that we treat. And there are some isolated blood vessels also that we're also doing. Let's go back and examine these photographs of before and after treatments and what can be achieved through sclerotherapy for varicose and spider veins. Now, as we see here at the pre-treatment, it's a large tortuous vessel. And let's look at that 6 weeks after the start and how much it's improving already. Then let's look at the 8-week shot, and we notice more clearing, and the little fine pink vessels are beginning to disappear. And here is a picture at 20 weeks after the beginning of treatment. As you can see, the results are truly remarkable. Micropigmentation is a permanent procedure done around the eyebrows, eyelids, or around the mouth for patients who have to conserve their time, who may have arthritis, or who may have poor vision. It is done under local anesthesia after pre-marking the patient and is done with earth tones which match the patient's complexion. The procedure takes normally less than 1 hour and is relatively painless. The areas enhanced are in here, here, the lower lid, and a very fine line around the mouth to make the lips look fuller and more voluptuous. The procedure begins with a sterile marking pen. After that, we use this per-mark enhancer into the pigment. This has four very fine rotating heads, and we go right into the eyebrow or the eyelid. The color for the lips is usually a light pink and a very thin line, which is hardly noticeable at any distance. And let's look at some photographs of patients who've had this procedure done. Micropigmentation is one of the newer procedures which allow us to pigment the skin in the area of hair loss. As is noted here, the eyebrows look natural, using safe, natural pigments, and this is a painless procedure. This 35-year-old female had very thin lips and desired to have a more cosmetically pleasing effect. We did fat transplantation to the lips and the micropigmentation at the vermilion border, which is where the skin meets the lip tissue. This is a very satisfied patient. I hope this instructional guide has answered many of your questions. And more importantly, I hope you will now be in a much better position to take that first step in changing your life. All these new and exciting techniques were developed for you. You do not have to live with problem and aging skin and other abnormalities. You do not have to suffer with bulging thighs, droopy arms, heavy legs, or abnormal knees. You can eliminate varicose and spider veins, both of the face and legs. You can renew your skin's youthful luster and rejuvenate those aging and unattractive areas of your face, in most instances without a facelift. Chemical peeling, dermabrasion, and my pioneering chemodermabrasion are among the best-kept secrets in cosmetic medicine. Autologous fat transfer, that is the liposculpture of the face, is a major concept to be kept in mind. Before you begin, some words of advice. If after viewing this tape you are interested in any of these procedures that I've demonstrated, please remember that some of these techniques are quite new and represent the latest breakthroughs in cosmetic surgery and dermatology. It is very important that you ask your doctor if he or she is familiar with these new treatments. Do not be afraid to ask the doctor how many procedures they have done. Ask to see before and after pictures. And be sure your doctor is board certified and has an affiliation with a hospital. You can even request the names and telephone numbers of patients so you may ask them directly if they were satisfied with the results. In our office, we call these people patient consultants. Remember, every case is different. It is extremely important that the doctor gives you a realistic appraisal of the expected results. But most of all, be an informed consumer. And now a word about costs. The reason I have not included fees for the procedures that I've talked about on this video is because they can vary so widely around the country and the world. Individual operating costs, including office overhead, staff, and other factors, are different for each location and each physician, and can have a significant impact on costs. So once again, you have to be an informed consumer. Comparison shopping is all right, but just as important is your relationship with your personal physician. Ask yourself these questions. Do you feel comfortable with him or her? Do you like the results you have seen on other patients? Is there a positive attitude in the office and with the staff? These are very important factors. But you can take assurance knowing that there are many highly skilled and talented doctors working worldwide. So now you know the facts. The next step is yours. Go ahead, take it. And here's looking at you.
Dr. Fetter performs all the procedures shown in this video. His fees are highly affordable, and he invites you to visit his Fifth Avenue clinic for a personal consultation. If you would like more information about Dr. Fetter, his treatments, his services, or the more than 120 products Dr. Fetter has created and dispenses to his patients worldwide, please feel free to write or call Dr. Fetter for a free brochure at Louis Fetter, MD, 965 Fifth Avenue, New York, New York, 10021. The telephone number is 212-535-8700.